Some questions that people might ask: how quickly do I see improvements in my thyroid symptoms? Now, as you saw, Jennifer said, I think within a week, you already saw an improvement. We expect to see improvements as early as, let's say, 1 or 2 weeks, and also over the following 6 months, and maybe even up to a year. Some possible post-procedural symptoms that patients might experience. I'll let you talk on that, Jen,
Okay.
if you've experienced anything.
Sure. With my nodule being so sizable, after the first procedure, I was a bit sore and I did have some swelling. With smaller nodules, as with my second procedure, there was less there left to treat. So after the second procedure, I was not swollen at all and I was not very sore, but I did find that an ice pack did help prevent that swelling that I had the first time. I know also I've heard patients talk about having soreness in their neck or their shoulder and sometimes in their ears. That generally is not something that lasts very long, maybe less than 24 hours. And then as you say on your slide here, fatigue, I did feel a little bit extra tired for about a week after that first procedure. The second one, I was hiking the next day. So I think it does play a role how large your nodule is and how much tissue you had ablated, exactly how you're going to feel after the procedure.
Can I have COVID vaccine post-thyroid RFA or just before my thyroid RFA? So there's no contraindication to getting the vaccine. Can it be performed on malignant tumors? And the answer to that is no. If you remember the chart that we talked about, who knows in the future with changes in technology, and maybe that's something we can hope for. But as of now, no, because anytime there is cancer, we need to make sure that it's all out. And especially if there's concern for any lymph nodes, if there's any concern for spread of the cancer. What are some common complications of thyroid RFA and how often do they happen? So again, I don't like the word tumor, but is there the chance that the nodules can grow again? Potentially, yes. And over a 5-year period, that percentage chance of it growing is about 20%. There can be, in very rare instances, the skin could get burned if the equipment gets overheated. Again, if done in a very careful manner, this should not happen. Of course, anytime you are breaking the skin with a needle, there's the chance for infection, but it's also, again, very rare. Having some bleeding. And then a very rare thing that could happen is an abnormal heart rhythm. However, there are pads put on for grounding to prevent any kind of electrical charge causing any heart problem. However, I would say that if anybody has any kind of like a pacemaker or anything like that, that is a contraindication. So that person would not be a good candidate to get this done. And that brings us to the next question, that who would not be a good candidate for thyroid RFA, and that would be, again, somebody who has a malignant or suspicious nodule, or somebody who has a pacemaker or other implants that might cause issues with the electricity. And then indications: patients must have 2 benign biopsies of every nodule that is going to be ablated. That's to make sure, especially when you have a larger nodule, the more samples that you get, the better chance you have of ruling out cancer. Because if you think about it, like in Jen's case, hers was about 5 centimeters, actually more than 5 centimeters, and there's no way to biopsy every single cell in that nodule. So we do it based on its percentages. So doing 2 biopsies, having 2 negative biopsies, there's a higher percentage chance of there not being any cancer.